Good morning, afternoon, and evening to the YouTube universe. This is April Lynn Grubb. I'm a senior level nursing student at Indiana State University, completing my final community health education for Nursing 444 Community Health. And I'd like to talk about adult preventative medicine today. So preventative medicine focuses on screenings and tests that look for problems in your health before you have any symptoms, which would be signs that you have a disease. Every adult has preventative screenings throughout their life available from age 19 and up. In the comment section of this video, you will find a pre-test, post-test, and a handout. Go ahead and take the pre-test before you begin this education so that you can evaluate your learning. Our learning objectives today are listed here. We're going to discuss typical wellness schedules for adults, identify routine lab work that should be done, vaccinations, screening tests, additional screenings for those age 40, 50, and 65. Here are some of the standard wellness visits. So a standard wellness visit would be for anyone who is 19 and up. So every year, you should have your weight, height, BMI calculated, your blood pressure taken. You should have a skin cancer screening, which is simply a skin check. You should double check that your immunizations are up to date and should have a yearly flu vaccine. You should have a depression screening at least once a year. A cervical cancer screening for women, there are different rules based on your age, and your doctor will know which is which, but especially at age 19 to 25, you should be getting those yearly. Breast or testicle exams, those should be completed in your home by yourself, but then your doctor should also complete one once a year. And then this lab work that you should have done, your doctor will decide how often you need to have this done, but typically you would want to have your cholesterol, a CBC or a complete blood count, metabolic panel, thyroid panel, liver enzymes, STD screenings, and a blood sugar check. The STD screenings typically fall to our younger, more polyamorous type adults. However, if there are risk factors, you will have an STD screening regardless of age. Adult screenings, 50 years of age. So in addition to those annual screening tests that I showed you on the last slide, at age 50 or younger based on your medical and family history. If you are someone whose parent may have passed away from colorectal cancer in their 50s, you may start screening for colorectal cancer in your 40s. So colorectal cancer screening or colonoscopy should be based on your risks. Typically it's starting at age 50, but could be earlier. You can get a shingles vaccine at age 50, which I definitely recommend. If you've never had shingles, I hope you never have to get it. Lung cancer screening. This is based on if you have been a smoker in your life and your age. At age 50 or 55, they may recommend that you get a low-dose CT lung cancer screening. A prostate exam starts at age 50. Mammograms typically start at age 40, although there are women who have risk factors that they could start as early as 35, but 40 is typically our baseline. And then a hepatitis C screening once if you were born between 1945 or 1965, or you have other risk factors like IV drug use. When we go to 65 years of age, in addition to those annual screening tests on the first two slides, at age 65 or younger, again, based on your medical or family history, we're going to do an osteoporosis screening for both men and women. At age 65, that's when we start giving a high-dose influenza vaccine. So when we hit age 65, we know that our immune system just simply doesn't kick in the way that it used to. And so to get this same protection from life-threatening illness from influenza, they do a high-dose influenza vaccination for those 65 years and up. Also a pneumonia vaccination, and then they do a fall risk screening. If you fall 65 years of age and up, there are things you can do to prevent breaks. There are things you can do to prevent falls. So it's very important to have those screenings done. Common adult immunizations. I threw in hepatitis A and hepatitis B here simply because we are seeing a rise in hepatitis A in this part of the country, in Indiana, and we didn't used to have any hepatitis A, so it was never included in routine vaccinations. However, we've had large outbreaks, especially around the Chicago area and in Indianapolis, so they are recommending hepatitis A vaccination. And that is a two-part vaccination, one vaccination for 6 months apart. Hepatitis B, it's typically a vaccination that we've already had. However, there are adults that typically need boosters or need to have that checked. So that's one I throw on here. Pneumonia, there's multiple pneumonia vaccines, but your doctor will be able to advise you which one is best for you and which ones your insurance can cover. You should have an influenza vaccine yearly to prevent life-threatening illness from influenza. It doesn't prevent you from getting influenza entirely, but it does help keep you out of the hospital and keep you from dying from the flu. Tetanus, diphtheria, and whooping cough, otherwise known as a Tdap. You should have a Tdap every 10 years unless you have an injury that precludes you from tetanus, and then you should have it within 5 years. And finally, that shingles vaccine. Anybody who's had chickenpox in their life is at risk for having a shingles outbreak. So those adults who are outside the realm of when we started giving chickenpox vaccinations definitely need to get the shingles vaccine. Good health tips for adults is to simply be physically active. Walking is an absolutely great tool for adults. Make healthy food choices, focus on a healthy weight, be tobacco-free, and you want to limit your alcohol to 1 drink per day. And I kind of gave you a gauge there of what 1 drink is. I know all of our glasses seem to get bigger and bigger, but the answer is it's still only 1 drink per day according to those standards. Preventative medications. There are preventative medications that can be utilized for you depend on your personal history or risk factors, your family history. You may need to take medications to prevent stroke, cancer, birth defects, or you should take a vitamin. So common preventative medications can be aspirin. There are breast cancer drugs. That kind of sounds crazy. Well, why would that be a preventative? If you have a particular genetic defect called a BRCA, if you are BRCA positive, they may recommend that after a certain age you start on a breast cancer drug that will inhibit those breast cancer cells from developing. Folic acid prevents birth defects. Vitamin D can actually help prevent falls, and iron can help prevent anemia. In case you needed any resources for the information I've presented today, these are some really good resources. AHRQ is a quality group here in the U.S., and they do have lifestyle recommendations. I found this Columbia Doctors website that was honestly really clear and felt like it presented good information. The Center for Disease Control, CDC, Mayo Clinic is always a reputable resource. And then the Healthy People Initiative, which is a US initiative, is there for you. And I did utilize all of these in the making of today's presentation. If you would please go ahead and take your post-test and see how much you learned today. Feel free to rewatch or relearn. And if you have questions, I encourage you to speak with your doctor. Thank you and have a great day.